Hey there, and welcome back to PCOS Unfiltered, the space where we cut through the noise and rewrite the stories we've been handed. I'm your host, Lindsay, and today's episode is going to challenge a narrative that far too many women have been told. That's just normal. Whether it's fatigue, bloating, weight gain, or being dismissed because of your diagnosis, you've probably been told to accept a version of health that feels anything but empowering. My guest today is Samantha Beckton, owner of Not Now Therapeutics, and she's here to flip that script. As a certified bodywork therapist, Samantha has helped countless women reconnect with their bodies and shed the idea that they just have to live with it. We'll talk about how lymphatic massage supports hormone balance, detoxification, and inflammation, and why it's a missing link for so many women, especially those navigating PCOS. Plus, we'll get real about how powerful it is to question what you've been told is normal and how you can begin to reclaim your story. So, if you're ready to ditch the diagnosis mindset and move toward healing that's actually aligned with your body, this episode is for you. As always, the content shared on PCOS Unfiltered is for informational and educational purposes only. The views and opinions expressed by the host and guests are not intended to serve as medical advice. Always consult with a qualified healthcare professional before making any changes to your diet, exercise, or treatment plan. The information shared is based on personal experience and expert interviews and is not a substitute for professional medical guidance. Now grab your foam roller and let's get into it. So what was your turning point? Like, what was your big aha that turned everything around?
There's been so many. There's been so many. But
well, that's good because it shows you it's not a straight line. Like, or even if you hit that point, then it's not a straight line. It's up and down for sure.
Totally. Now, I alluded, I was a high level athlete. I was an aerial acrobat. I'd been in 7 pretty major car accidents by the time I was 20 as a passenger, most of them. I'm not horrible of a driver, but my neck is a mess, and it's like when any of these things happen, what's the go? You go to a chiropractor, right?
Yeah.
Hey, whatever. And so I remember, so when I was an aerial acrobat and I was doing these big drops from the ceiling, I was just giving myself whiplash over and over and over again. And I remember, like I'd be like, to look at, because I couldn't even turn my head from side to side. I had daily headaches. All these things. This is in my 20s.
Yeah.
Right. And I had a young son. So I know what it's like to not show up and be your best self. And they just didn't give me anything to fix it. $5,000 in like chiropractic, blah, blah, blah. But they're just manipulating you. Mm-hmm. And I was like, yeah, I don't want to do that. And I remember they tell you these fear tactics, right? Like, anybody is listening to this right now, and you've been told that you're the worst case of X, Y, and Z that they have ever seen, that is marketing. Every single person that I know has been the worst case that anybody has ever seen. I've been the worst case that anybody's ever seen. And if you're the worst case that anybody's ever seen, then you become dependent on that person. You're the worst case.
That's sad, though.
It's sad.
Yeah.
Yeah, it's sad.
Yeah.
So I was just like, I just don't know. And that's when I started working on myself and working on my own neck. And I ended up fixing my own problems because the chiropractic doesn't address the muscles. And so when I'm talking about things like that, more physical, like muscles move bones. Bones don't go moving around all willy-nilly by themselves. It's not like my neck is like, I'm going to be over here without my muscles working on, like moving it. So if there's a problem with my bone, and there has to be a problem with my muscle. So why are we always just pushing the bone and not working on the muscles? I'm like, I'm gonna work on the muscles. I'm gonna work on my posture. I'm gonna work on these things. Yay. So I couldn't lift my arm up for a year and a half, over 90 degrees. I injured myself doing doubles trapeze. And that's when I went to school for physical therapy. Didn't learn anything, nothing. I saw like 27 different massage therapists at least, many different chiropractors. And this is where I started to learn, like, not just because somebody is something doesn't mean they know something. Like
Yeah.
massage therapists all know different things. And the vast majority of massage therapists went to school for like spa work. No, no downing spa work. You know what I mean? If you want to go somebody and have them rub lotion on you so that
Yeah.
you
And that still
relax,
helps with stress and yeah.
totally. But
Yeah.
don't expect that person to know anything about true pain relief. And then
Mhm.
we go to them, right? And then it's like, well, I just went to somebody and it felt better for a little bit, and then it felt worse again. And it's just a band-aid.
Mhm.
Well, it's a band-aid because you didn't change.
Yeah.
You're still being you, which means like the problem, if you have a problem, the problem is you, right?
Yeah.
So we have to figure out what it is, right? And there's something happening in there. Again, like I go back to the sitting cross-legged thing, but I think when we're talking about like what really drove it home for me is I ended up fixing all of these problems muscularly. And then this will drive home because this is a female problem. I had a pelvic floor injury, and um and it kind of came on over time until one day I could not stand up, physically could not stand up straight without shooting pain through my vagina and my anus, like could not stand up.
Wow.
And it was bad,
Wow.
and it was a Sunday.
Mm.
And like, I mean, I'm a high level athlete, I've been in some pain, and I went to the emergency room where they drug tested me, right? And then like to make sure that I wasn't just drug seeking.
Yeah.
And then because ER sees everything.
Oh yeah.
They want to make sure I
I
wasn't
can
putting
tell you some stories.
foreign bodies up in there, right? So all of these things, I did a CT scan, all of this stuff. They couldn't find anything wrong with me. They diagnosed, this ER doctor diagnosed me with a tummy ache. And you have to know I lost my mind, right?
Oh my
And this
gosh.
is where
Yeah.
I go back to like the anger thing, like, you know what I mean? And it's like, I looked at him and I was like, I don't know what doctor school you went to, but I'm an educated human being. And I happen to know that my tummy is nowhere near my vagina. So give me a correct diagnosis. That would be great. And they're just like,
get her out of here.
right. So they ended up giving me like an IV muscle relaxer, like you would for any 2-year-old with a tummy ache.
Mhm.
And then they gave me a prescription for muscle relaxers, and I can't remember what it was at this point in time, and sent me on my way, told me to go follow up with my, OBGYN, whatever it is.
Yeah.
So I did that. I went into the OBGYN and they did like the vaginal ultrasound, couldn't find anything wrong. She's like, well, maybe a cyst ruptured. Maybe. And I was just like, no, I'm in pain. I had a burning pain in my what I would consider my ovary, like ovarian pain, like almost like, sometimes you get a little crampy when you're ovulating or something like that. I had that burning pain for 4 years.
Oh my gosh.
Oh yeah, I thought I had ovarian cancer. I thought I was dying, actually.
Wow.
And I was just like, what is going on? But they couldn't find anything wrong with me. I worked in physical therapy. I was working in a women's health clinic. You know what I mean? I was like, can somebody please check me out? They're like, you need to make an appointment. And you have to know I'm not doing that. Somebody was like, why don't you just go sit on a tennis ball? And I was like, seriously? Like,
Oh my
and a
gosh.
whole lot happened within that system. And I ended up looking for a different job. I moved to Florida and I was working for a husband-wife duo in women's health. Now, this is going on 4 years, right? And so now my hip is really bothering me. Like for 4 years.
Yeah.
And I'm doing everything that I know how to do. And I'm pretty good at what I do, right? For the hip pain. And it would get better and then it would get worse, right? So I understand the whole like, it felt better after she worked on it, but then it got worse. And I was like, I'm missing something. I'm missing something. I'm missing something.
Yeah.
So I moved to Florida. I'm working for this husband-wife duo, and I'm throwing everything at it. I'm exercising 9 hours a day with all of my clients. I'm on the traction thing, which made it so much worse. Oh my God. Right.
Wow.
And like all of these things. And so finally I went to Gina, who is a pelvic floor specialist. And I was like, can you please just like go up in there and just tell me if I'm dying? Like, I just want to know if I'm dying of ovarian
Yeah.
cancer. So she did a pelvic exam for me, and I lit up like a damn Christmas tree. When she hit, oh, I don't have my pelvis. Let me grab my pelvis really quick. I feel like it's important. So she did my pelvic floor exam and went up in there and started like feeling these muscles in here. They were like, right, going
Oh
crazy.
my gosh.
So she just was just like, this is your problem. You have so much tightness inside of these muscles. And she probably treated me like maybe 3 times in 2 minutes between clients. Like I'd run in there, take my panties off and have right? And then run back out. And then I would do all of the external work, working my adductors, my hips, and all of that. 3 little 5-minute thingies with her. Every single symptom I had went away. Oh, and what I forgot to
Oh my
mention is
gosh.
not only was I having the hip pain and the back pain, then I started to become incontinent. Right. So I went to the
Which,
bathroom,
yeah.
right? And then I would think I was done and I'd stand up and I'd dribble all in my panties. Very common, right? Normal for people. It's not. And so and I was like, oh no. I mean, I was 36 years old at the time. And I was like, I am 36 years old. I cannot be peeing myself. I'm not gonna be. And what did they tell you to? Oh, just get Depends. Just wear a panty
Yeah.
liner. That's not gonna
Yeah.
fix the problem.
Yeah.
And
Yeah.
so and then I had another symptom called dysuria. So what that means is that I always go to the bathroom at night before I lay down to go to bed. I go to the bathroom, I'd lay down to go to bed, immediately feel like I had to pee. I was like, do I have a urinary tract infection? Like, what is going on?
Yeah.
So I'm having all this testing done, nothing, 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 nothing. And I feel like I'm insane, right? Everybody's telling me there's nothing wrong with me, and there's a very real problem. So after she released those muscles, I was like literally like a week after 4 years.
Oh my
And so I
gosh.
was just like, like, how can I do this myself? And she
Yeah.
ended up giving me a pelvic floor wand. And so
Ah.
anytime I feel like, because I can feel it, like if I'm
Yeah.
running, something like that, now I have that propensity, right? Like this is
Yeah.
like patterning in my body. And so I know that I can use my pelvic floor wand and I can go in there and I can release those muscles all by myself. I don't need
Yeah.
anybody else to do it for me. And like I have zero symptoms, zero pain. I am 46 years old. And because of all of this work that I've done on myself over the years, and I know how much of it is muscular and posture wise, and I've fixed my posture and I'm working on my body all of the time, I have zero pain in my body, zero. And so, isn't this the time that I'm supposed to be feeling worse? Isn't this the time that all these things are supposed to be coming out? I was worse when I was in my 20s and 30s.
I was too.
I I was worse then because I didn't
Mhm.
know anything like what I know now. And because I I take massive action, right? And because I'm working on my body every day, and because I prioritize my personal health in what I eat, in my movement, in my self-care, in my therapeutic rolling, in the
Mhm.
fact that I will take a pelvic floor one and go up my hoo-ha and release my own muscles, you know what I mean? That I more than that, that I understand. And I think that that's one of the things that a lot of people miss. They take their diagnosis, they don't even know what it is.
Yeah.
You know what I
Yeah.
mean? So
Yeah.
that was that, like the pelvic floor thing, when that happened, it just came crashing through my mind that like I don't need the medical system. And
Yeah.
and that anytime something comes up, that it is for me likely muscular or something that is, and I'm going to treat every single thing I know how to do for it with intention and consistency before I go to see anybody else, because that whole 4 years of
Oh my
like
gosh.
thinking that I was dying and that, like, that my insides were falling out my vagina,
Yeah,
like, absolutely.
that's crazy.
And people live like that.
Yeah, yeah. I will say, side note, if you're on the audio version of this, go to my YouTube channel so you can actually see what Samantha just did.
I mean,
Um,
I'm a little ridiculous, you know what I mean? But I mean, like, at a certain
yeah,
point, if we can't laugh at ourselves.
yeah, yeah. But no, but I mean that's super, super powerful. Because I mean I say it so many times in my episodes, talking to clients, I mean, everything. And it's like, you know, your body. And yes, that's where the breakdown in the medical system can happen too, because they just look at these, you know, your labs, you know, do an assessment, everything's normal. You know, if it gets worse, let me know. Or take this pill to cover up whatever it is for a little while. So, you know your body. And so there might be something deeper going on there. I mean, I used to even tell my ER patients, you know, when they leave with certain things, I'm like, you know yourself, even though now looking back, I didn't even know my body that well. So, but I feel like you kind of know if deep down, if there's something more serious going on that is not being found by traditional medicine, then you actually have to go out there and do some more research, do the research for yourself, or find somebody like, Samantha or me, or, somebody in that realm that can help you with whatever it is. So yeah, I think,
100%.
yeah.
And to piggyback on what you just said, I told you I went to school for physical therapy because of my shoulder. I remember they did all the MRIs and stuff. I remember talking to the orthopedic surgeon who wanted to open me up and do an exploratory surgery on my shoulder. And I looked at him, I was like, I just feel like my shoulder is dislocated. And this man says to me, your shoulder's not dislocated. If it was dislocated, you would know. That's what I just said. And I remember when I finally found somebody to help, the person who ended up helping me with my shoulder, that I ended up studying with and learning all of this trigger point myofascial release with, right? After I got out of PT school, I never, like, I didn't go to, I went to her courses, right? Because I was
Mhm.
just like, everything that they taught me is stupid. I remember going to her and I was like, and you can see like from the side that my shoulder is like way like this somehow,
Yeah.
because things that I do with my clients is I actually look at them, right? and and I was like, I just feel like my shoulder is dislocated. And she was like, well, yeah, it totally is. And I told her like what the doctor said. She's like, there's degrees of dislocation.
Yeah.
But
Yeah.
like all of my muscles were so tight and pulling everything forward. It was literally pulling my shoulder forward in a socket. So when we went in and opened up my pec, opened up my subscapularis, literally again, a year and a half, I couldn't lift my arm up. In a week and a half, I had full
Oh my
range of motion
gosh.
and no pain. And I
Yeah.
was just like, what? I was like, well,
Wow.
and for me, I was like, I want to know everything she knows, right?
Yeah.
Same
Yeah.
thing happened with the whole pelvic floor. As a massage therapist, you're not allowed to go do internal work. You're not allowed to
Mhm.
go inside. Um, so once Gina kind of did her little magic in there, I was like, and I'm inspired by these things. I'm inspired by the things that happened to me. So I was like,
Yeah.
well, I need to know how to do this, right? So I used my PT. Like, this is probably if anything else, this is the reason why I had a medical license, is because I couldn't take those classes without one. You can't take pelvic floor classes as a massage therapist, because could you imagine? Um, like I was saying about abuse of power. So,
Uh,
but anyway, I couldn't take those medical level classes without a medical license. So I
yeah.
was really fortunate that I was able to take those classes. And I talk to people all the time, and I'm like, I think you have this going, I think you have this going, I think you have this going on. And unfortunately, some of them are like, well, yeah, but it costs money. And I'm
Yeah.
like, you gonna spend it anyway.
Yeah. Yeah.
Like nice, nice fingernails, you know, like nice streaks of color in your hair, or like,
Yeah.
or if it was your car and it needed new brakes, chances are you wouldn't have a problem, doing something like that. But it's so fascinating because with our bodies, and it's like,
We
it's
don't.
an investment in ourself and in our life and in our happiness and in
Yeah.
everything. And women primarily feel guilty
Yeah.
investing in
Yeah.
themselves.
That's so true.
Mhm.
Yeah. I see that a lot. I talk to, yeah, a lot of women. One of my recent, yeah, somebody I recently talked to, same thing. And she was like so busy and all this thing going on. But she needed my help, but she wasn't willing to make that sacrifice for herself. Like, to give up some of these other things to be able to make that sacrifice for herself. So, yeah.
I know. I'm
Um,
going to piggyback on that for just a second because I just finished my pain-free living experience, right? And I do a week-long thing. And I had a woman who came to this. She has been sleeping on ice packs for 2 years.
on
Because
ice
she has
packs.
on ice packs because she has such radiating pain in her butt, right? At like where her bones meet the chair. But when she lays down to go to sleep at night, it is unbearable.
Oh
Has
my
been
gosh.
sleeping on ice packs for 2 years. 2 years.
Wow.
And she has been to everybody, don't you know? Like I can and I asked her last night how much money she feels like she's probably spent on this so far, right? It's like way up in the thousands, like way thousands, right?
Yeah.
Pain, been to PT, been to the doctor, has had dry needling, going to chiropractors, all of it. She's been sleeping on ice packs for 2 years.
Mhm.
She was with me for 5 days. I taught her like two things, right? Well, first of all, I was looking at her and did the posture assessment and the whole thing. And I was like, well, this is what I think it is. And this is what I think is going on. And this is why I think this is happening when you go to sleep at night. So I taught her a strategy, literally just how to release her hamstrings, right? Because that's where, whatever it is.
Yeah.
The first night she was like, I didn't get up in the middle of the night to change out my ice packs. So
Oh my
she slept
gosh.
better than she
Yeah.
had slept, right? All of these things. So we get down to the nitty gritty, like, are you going to come into this program and see how much better I can get? Because I have a 90-day program, right?
Mhm.
And then through this time, she has a dog that has like some esophageal sphincter issue and like can't drink water and like all of these things, going to the vet, all this testing on the dog. You have to know that that shit is more expensive than my program, right?
Yeah.
So we get into it and she was just like, and we'll see what happens. And she was just like, oh, that's a lot more than I thought it was going to be. I just don't know if I could do that. But if it was the dog,
Yeah.
you know what I mean? And I was just like,
Yeah.
you've been sleeping on ice packs for 2 years. To do something in one day. Like, how much
Mhm.
better do you think this could get for you? Like, and like, still, it's just like that guilt and shame of like
Yeah.
investing, like, never. I
Investing in yourself, like, yeah,
all of it, all of
actually
it.
being the one taken care of instead of being the caregiver all the time. Like, I think that's just in us, I'm a stepmom, I'm not a mom, but I mean, it's still in me, and I think that that's why I got into nursing to begin with, because I still just had this passion to help people. So, um, yeah, so it is. It's very hard, and you have to. At what point do you realize you shouldn't feel guilty about that? You would think that'd be a breaking point for somebody in that situation.
One would
So,
imagine.
Yeah.
But, I see it all the time, and you probably see it too, because if somebody took your car to the mechanic and they told them that they needed new drums and brakes and some new tires and it was $5,000, they just pull out the credit card and pay for it.
Yeah.
Car
Yeah.
is way more important than we are,
Exactly.
or whatever it is. You're taking your car and getting that regularly scheduled maintenance. You're getting weekly, you're
Yeah.
getting like the oil change exactly on the time. There's a little
Yeah.
stamp that says, got to get your oil change. You do it. But we are
Yeah.
not doing that for ourselves.
Yeah. Yeah. And just like the car, you have to keep everything running smoothly so you don't get all the check engine lights and all that stuff. Our bodies are the same way. Yeah, they want to run smoothly too. And so you don't get the pain or the check engine light.
Girl, we've been
or whatever
putting
it is.
super premium unleaded in the car and then going through Starbucks and poisoning ourselves. You know what I mean? It's like, what?
If this conversation with Samantha lit a fire in you, if you're thinking, wait a minute, maybe this isn't my forever, then know this, you are not broken and you don't have to settle for survival mode. Healing starts when we question the labels, the limitations, and the lies. And it deepens when we tap into the tools that support our body's natural rhythm, like the lymphatic system that's been overlooked for far too long. I will put the links in the show notes so you can connect with Samantha and learn more about her work at Not Now Therapeutics. Her sessions, her philosophy, and her heart for women's healing are truly one of a kind. Until next time, keep nourishing, keep healing, and thriving.